And our emphasis is around people with lived experience, because through the courage of them telling their stories, we're able to work in partnership with our service providers, police, QAS, hospital and health services, to design services that meet the needs of our community.
In Kilkivan, the main need is chronic disease management. There's quite an ageing population, and there's also quite a proportion of patients with socioeconomic distress. So it's mostly young couples, young people, and then the elderly. I'm very grateful to the PHN who have provided the funding to make the service available, and also continue to provide support so that the service can continue.
You think of Brainstorm and you might see a group of people coming up with ideas. But it makes me think about that feeling in my brain when things get too much. Like dark clouds have been building up and lightning starts. It gets too intense and I can't think normally. But people don't really see that on the outside, especially when things are like normal.
So the great thing about ADIS is that you don't have to be right at the end of your journey to be able to call them and seek advice and just have a yarn. ADIS provides free, confidential, 24-hour drug and alcohol counselling and support. You can call them anytime for a yarn. So if you're impacted by drug or alcohol issues or concerns, there is help available. And the most important thing is that these help and these support services, they work. They actually do work.
Health Pathways is an online portal that allows doctors, nurses and allied health clinicians to access local health information for over 500 clinical conditions. Health Pathways particularly benefits GPs and their patients by providing easy-to-use clinical guidelines appropriate to the local services available.
My health record is a record of your medications, what surgeries you've had. You're able to access at any time, and also if you end up being in an accident, it's accessible to people that need to have it. I think that's the main thing, is the right people get it.
If you have a mental health condition that has severe effects, leads to social disadvantage, and is likely to be permanent, you may be eligible for the NDIS.
A therapy centre for children struggling with behavioural or developmental issues has opened in Gympie. The multi-million-dollar facility offers free support services and classes for young kids to help prepare them for full-time school.
The facility is offering therapy sessions for children aged between 3.5 and 5 at no cost to parents. Home visits are also available.
We want to make sure that the young children here in Gympie start school with every chance of success.
I mean, we couldn't provide the program without the support and help of the PHN, to be honest. The PHN have helped us, bring an informal program into a more formal, more successful program. So that's definitely probably the key thing for us. I mean, we would struggle along, I think, but it's just great to have that support, and not just from a funding perspective, but support from great program coordinators, that's linking us into more broadly in the sector as well. Having that support, that's been just wonderful.
My health record, for me personally, I went to a doctor and I said to the doctor, "Oh, I've got my health," and she said, "I've already got it here." So I was very, very happy with that. So I just thought, well, that is one good reason to hang in there and keep with my health.
Our local PHN was able to fund us for the project of Benevolent with My Health Record adoption. Having PHN so close on hand has been absolutely fantastic, especially Paige Martins, Shah Sobel. They have been fantastic just to go to, ask many of the questions that I was not able to answer on records of registering our residents and stuff like that. So having the PHN so local to us is absolutely fantastic.